Hi, my name is Tamara Doolin. I'm a pharmacist with Nightingale Home Health Care. I'm happy to say I've been part of the Nightingale family for about 8 years now. We don't have a pharmacy at Nightingale, so I'm not filling prescriptions. I'm here to help our clinicians make sure that their patients are taking their medications as safely as possible. One of the things we want to make sure that our patients do is take the right medication at the right time. Over the course of the last 15 months, we have partnered with Philips with their medication dispenser and installed these in a few of our patients' homes who our clinicians deemed as needing help with taking their medications at the right time. The medication dispenser can be programmed at a certain time to remind the patient when to take their medication. The dispenser here is about to go off and tell me that it's time to take my medication, and I'll show you exactly what the patient has to do in order to obtain it.
Time for your medication. Press button to dispense. Time for your medication. Press button to dispense.
Okay, she has 2 reminders, and she will remind every minute for 45 minutes until the patient walks over and presses the button. At the time
for
they
your insulin.
press the button, there can also be another reminder added on there. It's not necessary, but it is. Medication comes out in a little cup, and the patient can open it and take all of their doses for that specific time. Okay, I already showed you what the machine does when it's time for the patient to take their medication. The patient has a total of 90 minutes to go over and press the button and obtain their medication for that dosing at that time. However, if after 45 minutes they haven't gone over and pressed the button to get their medication out, the machine will call their designated caregiver and tell them that their loved one is about to miss their dose of medication. Typically, in most cases, it is a daughter, a son, a daughter-in-law, someone who is actively involved in the patient's care. That way that caregiver can ensure that nothing bad has happened to the patient, as in the patient hasn't fallen and therefore they can't get to their medications or something like that would happen. During the course of our pilot program, which went on for approximately 15 months, we installed the Philips medication dispenser into 22 patients' homes. During that time, while the patients were using the medication dispensers, no one had any trips to the hospital. We take that as a great success with this machine, and obviously our goal is to keep our patients out of the hospital. We see this as a valuable tool.